ask, are you okay, you're okay, you're okay, until they start to tell you, it's hurting me. But in a normal case, you can do it like this. Can I lift this a little bit? Okay. All right, what you're going to do now is you're going to expose the armpit, and you're going to see the main area of the arm. You can see she's got a crease right here. Okay, the main crease in the arm. Essentially, the middle of that crease. Okay, it's in the center. It's in the center. And what you need to do here also, you might, and without playing around with the person, but I'm palpating to make sure that I'm not by the artery. You have the axillary artery. If you punctured it, of course, they won't die, but you don't want to puncture that artery. It's not nice if there's blood coming out of their armpits. It just wouldn't be cool. Okay, so then if I do this and I kind of close it up a little bit, you can see now we're pretty center. Okay? All right. Now, you okay?
Yeah.
You good? Your arm's going to be okay to leave it like
Yes.
this? All right.
I have a question. When you're needling, you go into that direction or just
No,
perpendicular to
you're going to
where?
actually go in
Here,
into it.
Oh.
Yeah. And you don't want to really be going deep. You're not going to take like a tooth-sun needle and stick it in there.
One, you know,
One sun, it's fine. Okay?
You insert into one sun. You need to
Half.
use half.
Well, one sun needle, but going in halfway.
Oh.
If you use a half sun needle, you're going to have to put it in too deep to the handle,
Okay.
right? And that's dangerous. We never want to put the needle in to the root, right? The shaft and the handle, it's the root. You never do that. You get a longer needle. Okay. Heart 2. How do we find heart 2?
Hard to
It's soon about the
here.
Where is it?
it's soon.
Read sun from.
the
So what do we have to do first?
elbow.
You have to find heart 3. Heart 3 is where?
On this.
The crease.
between condyle and the
Everybody's like, okay, right, the end of the axillary, the cubital crease, okay. Make sure that your patient is not doing that, because then the line gets longer, okay, so,
90 degree.
right. Between the bone and the end of the crease, okay. Part 3. Now we would measure approximately tooth sun. We'll see her hand and my hand a little bit smaller. 3 sun. I'm going to come back a little bit because, and here you can feel. I want you guys to start learning how to feel. She has an indentation right here. Okay? Feel it. Go ahead.
Also artery. The artery also below this.
You feel where it just drops down a little bit more?
yeah.
Right? Okay? Yeah. Okay, so now we have 1, 2, and 3. All right, now we can actually, if your hand's not comfortable in that position.
Oh, it's fine.
Yeah, you okay? You
Yeah.
can actually even put it like this now. It's more comfortable like that. You keep it how it's more comfortable. All right, now we have 4, 5, 6. Where's 4?
It's
How about if you're not sure, how about if you find 7 first? Where's 7? Okay. At the wrist crease, and where? What do you have to find?
Tendon first.
Flexor carpi radialis. I'm joking with you. I'm trying to trick you. You were right. Okay? That could be, because that could be a test question. Flexor carpi ulnaris, FCU tendon, right? And where do you have to be now? The radial side. Okay, so you're going to feel for the tendon. Okay, and here's her tendon right here. Right, you can see as I do it, so that's the flexor carpi ulnaris, right on the wrist crease. Now the wrist crease is this one here. It's not the one that's right up on top.
线 1 to 3
Okay.
线每条线
That's
都
7.
有3条线。
对。
Most people has 3 lines. The middle line.
Yes.
Okay.
Yes.
It's not this line.
No, because you're going to be right in the bone,
Oh yeah.
right? It's the middle. It's the middle.
Yeah.
Yes.
Middle.
Yep.
The middle line.
Okay. Part 6.
有3个，有3个。
Right?
到这儿骨头。
All right. So a half a chun on her would be. Let me have your pinky for a minute. Bring it over here. I'm just going to get an idea. A half a chun. It's usually your pinky. It's a half. Okay.
那就在下一个线。
All right. So now you can visualize what's a half.
差不多都很像。
And what? Another half? Right?
Okay. Okay, 7, 6, 7, 6, 5.
Mm-hmm. Also, you want to make sure, I'm moving it over just a little bit off the line. See, she has blood vessels. If you're going to needle, you're not going to stick it in there. If you need to move just a little bit to one side or the other, then you do that. If you can't move, if the point is right there, what you can do is take it and move the skin with, see how the blood vessel's moving to the side? Then you take the tube, all right? Take the tube and put the tube down kind of strongly, and then you can let go. The blood vessel will come up against the tube. Then you can put the needle in and you won't hit the blood vessel. Did everybody understand that? Okay. All right. One more. Where are we?
8.
We're gonna look for 8.
One more time? One more half a
No.
time?
Should be 4.
Yeah, one more half.
4 points here.
Right? Yeah, I said one more. Again, half. Okay, so all these 4 points are in Tuchun. And you could even double check too. Give me a finger. From here to here is Tuchun. We can just test to see. Is that pretty good? It's pretty good. It's almost exactly. Okay?
Where was that? What was that part?
Index finger. First joint to the tip. Tutsun. Right? Take 3 fingers and should match up with that. Because 3 fingers, right, is Tutsun. Okay? What about 8?
8 is the pinky finger.
Right? Slowly close your hand. Okay? Where the pinky, right? Okay, let go. Right between. Okay, it's actually a little bit lower. I can feel it's a little bit lower. Right there. There you go. And what about 9? The inside, right? Right? It's over here?
No.
You sure?
这是新的阳针。
That's already
Oh,
on.
inside.
Yeah, because then it jumps across. Small intestine, 1, 2, 3. Right? Then we're going to go to small, different color.